A prescription drug shortage hitting Coloradans hard. We've reported before on shortages of specific drugs like Adderall, but now one Greeley couple is reaching out to contact Denver 7 saying they're struggling to find any of their regular medications.
And we found they are not alone at all. So tonight they want to share their story as a warning to others. Here's Denver 7's Danielle Kreuter.
Robin and her husband George have been married for 43 years.
And you guys take care of each other?
Yes, we do.
She does more taking care of me.
A few months ago, Robin almost lost George.
He had a COPD exacerbation and he wasn't breathing.
She gave him CPR and he was taken to the hospital.
He's just on a lot of medication now. There's probably 15 or 20.
But they found even commonly prescribed medicines are hard to come by.
We called the pharmacy and they just basically told us they don't have any and that they would look around and see if another UC Health pharmacy had it.
And it's not just that pharmacy. They reached out to several pharmacies in northern Colorado, sometimes driving from city to find what George needs.
What goes through your mind when you're checking in with a pharmacy to pick up medicine that a doctor has told you is very important and they say they don't have it, the next pharmacy doesn't have it, and the next pharmacy doesn't have it?
It's shock. It's like, are we in the United States of America? We get a prescription prescribed and know what the medication is and what the therapy is to get better, and we can't get it?
A Senate committee report released this year showed new drug shortages in the U.S. increased nearly 30% between 2021 and 2022. Some are related to supply chain issues and others because suppliers themselves are shutting down. Behind those shortages, there is something much bigger on the line.
It's my family. We're fighting for George's life. He had an exacerbation that made him not breathe, and I had to give him CPR, and it was the most traumatic thing that's ever happened to us. And now we just want a chance for him to live and to use all of the resources that we have available to us.
As the two plan ahead to get the much-needed meds for next month, they hope there's relief soon for everyone whose health is counting on it. In Greeley, I'm Danielle Kreuter, Denver 7.
Going in depth, these supply issues have been going on since last year. That's when we first told you about the shortage of the ADHD drug Adderall. The demand for the drug dramatically increased during the pandemic, and pharmaceutical companies just could not keep up with demand. I spoke to Emily Zadvorny with the Colorado Pharmacists Society then, and she said at the local pharmacy level, there are still no good solutions.
Where can people go if they need their prescription and can't find it at their pharmacy?
So unfortunately, this leads to the pharmacy shuffle, right? And that's not good for patients either. So there's not a quick and dirty solution. I don't recommend turning to the virtual solutions because that's actually fueling this problem.
The FDA first declared an Adderall shortage back in October. So why is it still going on? Well, Adderall is a controlled substance. The DEA strictly regulates the entire manufacturing process and places quotas on how much one company can produce. It's also not just as easy as making more of it. Scaling up production of one drug can mean reducing the production of another.
With all that said, let's just take a step back here for a second. I know sometimes we can throw a lot of information at you at once, but the pharmacist you just heard Jacqueline talking to actually revealed one of the biggest reasons for the shortage. Essentially, they said more access to healthcare, more demand, more shortages. During the pandemic, many patients turned to virtual doctor's visits as healthcare expanded its reach with technology. Well, that caused a sudden spike in the number of prescriptions for these drugs, contributing to the shortages. The DEA attempted to step in this year by placing limits on the telehealth industry. In February, the agency proposed new rules which would require at least one in-person visit per year. The rule was supposed to go into effect this past Wednesday, but massive backlash prompted the DEA to push it back 6 more months.
So let's take a look at what you can do if there are supply issues for medication you need. First, call ahead to your pharmacy before trying to fill your prescription. If they don't have it in stock, call around to other pharmacies. Another thing you can do is have your doctor prescribe you a different dosage or strength of your medication. Pharmacies sometimes carry multiple strengths and some may be more available than others. Finally, to see if a medication you take is experiencing a shortage, you can visit the FDA's website. They have a list of all ongoing shortages and the reasons for them. We have a link to that database on our website.